Hey Health Explorers, welcome back to Daily Health Tips. Today we're tackling a topic that often causes a lot of confusion, but understanding it could literally save a life. We're talking about the big three: heart attack, stroke, and cardiac arrest. Now, you might hear these terms used interchangeably, especially in movies or casual conversations. But let me tell you, they are not the same. Each is a distinct medical emergency, requiring specific and immediate action. So let's clear up the confusion, shall we? Let's start with the heart attack, or as medical professionals sometimes call it, a myocardial infarction. Think of your heart as a magnificent pump that needs its own dedicated fuel supply. That fuel comes from blood, delivered through coronary arteries. A heart attack happens when one of these coronary arteries becomes blocked, usually by a blood clot, often forming on existing plaque buildup. This blockage starves a part of the heart muscle of oxygen-rich blood. And just like any muscle, if it doesn't get oxygen, it starts to die. Chest pain. Often described as pressure, tightness, squeezing, or aching. It can spread to your arm, especially left, back, neck, jaw, or stomach. Shortness of breath. Feeling like you can't get enough air. Cold sweat. Breaking out in a cold, clammy sweat. Nausea, vomiting. Feeling sick to your stomach. Lightheadedness, dizziness. Feeling faint. Ladies, listen up. Your symptoms can be more subtle, often presenting as fatigue, nausea, or discomfort in the neck, jaw, or back, rather than classic chest pain. If you suspect a heart attack, call emergency services immediately. Time is muscle. Don't drive yourself to the hospital. Next up, the stroke. If a heart attack is a heart attack, then a stroke is essentially a brain attack. Your brain, the control center of your entire body, also needs a constant supply of oxygen-rich blood. A stroke occurs when blood flow to a part of your brain is interrupted. This can happen in two main ways. Ischemic stroke. A blood clot blocks an artery supplying blood to the brain. Think of it like a clogged pipe in your brain. Hemorrhagic stroke. A blood vessel in the brain ruptures and bleeds, damaging brain cells. This is like a burst pipe. The symptoms of a stroke come on suddenly and can be remembered with the acronym BEFAST. Balance. Sudden loss of balance or coordination. Eyes. Sudden blurred or lost vision in one or both eyes. Face drooping. One side of the face droops when smiling. Arm weakness. One arm drifts downward when raised. Speech difficulty, slurred speech, or trouble understanding. Time to call emergency services. Don't delay. Just like a heart attack, time is brain with a stroke. Every minute counts to preserve brain function. Call emergency services immediately. Finally, we have cardiac arrest. This is arguably the most dramatic of the three. While a heart attack is a plumbing problem and a stroke is a brain attack, cardiac arrest is an electrical problem. Your heart has a natural electrical system that controls its pumping rhythm. In cardiac arrest, this electrical system suddenly malfunctions, causing the heart to quiver or stop beating entirely. When the heart stops, blood flow to the brain and other vital organs ceases immediately. Sudden collapse. The person suddenly falls unresponsive. No breathing. The person is not breathing or only gasping. No pulse. You cannot feel a pulse. Loss of consciousness. The person is unconscious. Cardiac arrest is life-threatening and requires immediate action. This is where CPR, cardiopulmonary resuscitation, and an AED, automated external defibrillator, come into play. If you witness someone collapse and they are unresponsive and not breathing, start chest compressions immediately and call for help. So, to recap. Heart attack, a plumbing problem in the heart. Symptoms include chest pain, shortness of breath. Person is usually conscious. Stroke, a brain attack. Symptoms affect face, arms, speech, balance. Person is usually conscious but may be confused or have difficulty speaking. Cardiac arrest, an electrical problem in the heart. Person suddenly collapses, is unresponsive, and not breathing. Understanding these differences is not just academic, it's about empowerment. Knowing the signs means you can act quickly. And quick action can be the difference between life and death. If you take one thing away from this video, let it be this. If you suspect a medical emergency, don't hesitate. Call emergency services immediately. It's always better to be safe than sorry. And that wraps up today's crucial health information. I hope this video has helped you distinguish between these serious medical conditions. If you found this video helpful, please give it a thumbs up. Share it with your friends and family. Because knowledge truly is power when it comes to health. And of course, if you're not already part of the Daily Health Tips family, hit that subscribe button and the notification bell so you don't miss out on our future health insights. Stay healthy, stay informed, and I'll see you in the next video. Disclaimer: The information provided in this video is for general informational and educational purposes only, and is not intended as medical advice. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. If you are experiencing a medical emergency, call your local emergency number immediately.